Joining me to talk about this is Scott Schober. He is the CEO of BVS and a cybersecurity expert. Scott, good to have you with us.
Oh, thanks for having me on.
Scott, over a third of smartphones now have some kind of health or fitness app. What are the privacy issues here?
Well, it's a big concern. Just the sheer number of downloads. You look at Apple iTunes Store alone, they got 130 billion downloads since inception. So privacy and security is a huge, huge concern. A lot of times the permissions that we normally will check off, we don't have time to read. And that's crazy, right?
But a lot of these apps don't even have a little check for you to say, are you okay with sharing the data?
You opt in automatically when you download that. If you actually read through it, it'd be kind of scary because what you're really giving them is the permissions. You're allowing them to have access to your content information, where you're located, your latitude and your longitude, and a whole bunch of other permissions. And what even more than that scares me is it allows them to sell it to others, marketers, advertisers, research groups, and they can do all kinds of things with that data.
Well, what kind of data are they collecting?
Everything. That's part of the problem. It gets your name, certainly, your email address. It can access your contacts, your location, and so on and so forth. And it's really the metadata, things associated to you. So in some of the cases, you're accepting the permissions, and it's not necessarily giving them your name, but what it's giving them is access to all the other things associated to you and your buying habits and things of that sort. Very powerful marketing information.
Well, a lot of this stuff is very, very personal. There was a fertility app called Glow, which basically tracked everything from menstrual cycle to sexual activity, and that got hacked. And that was used, you could just get that information by just knowing somebody's email. Are users aware that it has such a thin layer of protection? No,
not at all. I even did speak privately to a few women about that, and Glow is one of the apps, which is not one of the best rated. But no, they are not really secure, and they do give away too much information. People using the app are not aware of it, and that's the big concern. Creating
awareness is certainly an issue, but then you think about governmental intervention, and you have the Food and Drug Administration, the FDA. In February, they said that they were not going to actively regulate these things. Does that surprise you?
No, it doesn't. And you make a good point, Michelle. Think about it. It really, you would think it would fall under something, but under the FDA, it's at their discretionary advisement if they should or shouldn't intervene there. So it's really, the call is in their court. A lot more needs to be done.
You do in the U.S. have the act which says healthcare providers and insurance companies that collect data must ask for patients' permission before they use that data. It's the Health Insurance Portability and Accountability Act. Why are apps different? Why would this act not apply to this?
Yeah, that's the part that's kind of surprising to me. They kind of have a loophole in it, and they don't fall underneath that regulation. Things may change in the future, especially with all these revelations of security breaches and privacy, but right now it does not fall underneath that, and that's what's so scary. And it's just this weak monitoring through the FDA, so that's got to change so people have some level of privacy and security.
All right, so what's the solution, Scott? Say you do want to use this app to track your medication, track your fertility, track your fitness, whatever it is. Should you try and find the ones that do have a clause that allow you to opt out?
Well, it'd be pretty tough because pretty much all of them have some clauses. Actually, if the average person that downloads apps on their smartphone spent the time to read all the permissions and exceptions, it would take the average person 30 days just to read them all. It's ridiculous. None of us do that. We read through, we scroll, we hit agree. It's absurd. They need to simplify that. They need to regulate it and put it in layman's terms so we can understand what we're actually opting into and what privacy and information we're giving out.
Well, look, these apps are free. They monetize because they sell this data.
Yes.
Do you think that there would be a better market for apps that guarantee you that your data would not be shared, but that you would need to pay a subscription fee, for example?
Yeah.
Could that be the solution?
Beautiful point. I would pay for it. I mean, maybe it's a few dollars, but I'd rather pay a few dollars to know my personal data or my family's personal data is safe and not put out there and sold to marketers and advertisers. Excellent point.
I will consult with the health app industry free of charge. All right, thanks so much, Scott Schober, CEO of BVS and cybersecurity expert.